So there's a couple of things that I want to do some show and tell about, and here's the first thing. What you may see, not in long-term care, but you may see it in acute care, is something called an inline suction device. And how that works is that it attaches to the internal cannula, and this little guy is for respiratory therapy to instill some saline to help break up some of the secretions. So you have this guy, and it attaches to the suction machine, much like you had for the regular suction. And you don't need gloves for this procedure. You just turn on the suction. If they sound gunky, you go in. You just turn that off because of the noise. You go in and you suction this way, like so. And then you depress this button and pull it out. So that way everything is enclosed here. This is attached for up to 3 days, I think, 3 to 6 days. And you don't have to take a new kit out to do the suction, which is really nice. Another thing you might see is the sample cup. One of the most difficult things to obtain is a sputum sample, because it's really difficult for a person to cough up enough sputum for any kind of testing. So one way to do it, if the person does have a trach, is to attach this guy again to the suction machine, and then the cannula is right over here. This is the same kind of cannula that you would use for suction for cleaning. And of course, at this point, you would have gloves on, turn on the machine, suction as you would. And so the sputum gets captured here. So you'll have enough for a sample, just in case you need it for an infection. Okay, another thing you might see is a metal trach. And in that case, of course, it's not disposable. The ones that we have here are disposable. They're plastic and disposable. But you may see some of these, which you would have to clean and then replace. Something else you might see is a Yankar. And you're probably familiar with this from the dentist's office. And that, of course, you don't try to stick in the trach, but you can do some oral suction around here. Or if the secretions, I've heard people say that suctioning is a lot like, or cleaning after someone who has a trach is like wiping a baby's bottom, because there's so much secretion all around the chest area. So this is actually nice to get some of the secretions out of the way. Another thing you would see is this. This is part of your assessment, actually, is to make sure that all the safety equipment is in place before you suction. This is called an obturator, and what this is used for is just in case that you're doing some sort of cleaning, the straps got loose, and the entire trach is popped out because of a very forceful cough. It's an emergency situation, so you would grab an obturator, either an obturator or an extra inner cannula that should be by the bedside, and you would place it in. So you would grab your little device off the ground or on the bed, wherever it fell, and you place the obturator in. It's kind of like a guide wire, and replace a little more gently. Replace that, and make sure you remove that, because that would plug up his airway. Another piece of equipment that may or may not be on the trach itself is called a cuff, and you'll probably learn more about this in class. This cuff right here, this little balloon, correlates with the balloon on the inside of the external trach. Okay, go. Another thing you might see are these guys. You may be familiar with these because they look like toothettes. However, they have this little device at the end for suction. So when you can, again, use the suction here, connect it at this point, and you can freely do oral care on the patient without risk of aspiration, because it sucks all the fluid in here. And it comes with its own mouthwash, which you would dilute half water and mouthwash.